Before we get started, please remember this podcast is for general educational purposes only. We're not providing medical advice, diagnosis, or treatment. Always consult your own healthcare provider about your care. Welcome to Fertility Nurses Unfiltered. 2 nurses, 1 mic, no bullshit.
I'm Ashley LaRue, fertility nurse and founder of Fertility.
And I'm Laura Wepler, fertility nurse and founder of Navigating Fertility with Laura.
You got questions, the internet has a lot of opinions, but what you really need is 2 fertility nurses who aren't afraid to tell the truth.
No scripts, no sugarcoating, just honest, evidence-based nurse-to-nurse conversation. So let's get into it. Hey everyone, welcome back to this week's episode of Fertility Nurses Unfiltered. Ashley and I are so excited to be here with you today, and today we're joined by Julia Neto. She is a prenatal and postpartum fitness specialist and the founder of Her Move Wellness in New York City. So Julia is a prenatal and postpartum fitness specialist and the founder of Her Move, with more than a decade of experience as a personal trainer in New York City. She specializes in exercise for fertility, IVF, pregnancy, and postpartum recovery, helping women make informed, evidence-based decisions about movement throughout every stage of motherhood. Through her work, Julia has supported countless women undergoing IVF and collaborated with fertility experts to develop accessible fitness education and programs, including a free IVF workout program approved by reproductive endocrinologists and designed to help women safely navigate exercise during fertility treatment. Her mission is to empower women with a better understanding of their bodies at every stage and help them continue moving with confidence, not fear. Thank you so much for joining us today, Julia. I know Ashley and I are super stoked to have this conversation today because I think a big thing that we hear from our patients and also heard when we were in the clinic is like, can I continue exercising while I'm going through my fertility journey? And, you know, I run every day and like, is it okay to keep doing that or what's safe? And, you know, we talk about ovarian torsion a lot on the medical side. So really excited to dive in with you, but would love for you to tell us a little bit of how you started your business and, you know, what was the onus for bringing you to this point. So tell us a little bit about yourself.
Sure. Thank you so much. I'm really excited to dive in from both a professional and personal lens today, so it should be fun. I have been like a movement person my whole life. I was a dancer and I went to school for dance, moved to New York to dance professionally. And if you haven't noticed, a lot of fitness people are dancers because, you know, you just get this really good understanding of your body from an early age and this like comfort with the human body. So that's how I got interested in fitness. And then right away, I was lucky, like the second I graduated college, I started specializing in pregnancy and postpartum. So I was very young when I got in the game. Like a lot has changed in the fitness world since, and even a lot has changed in terms of what we know about prenatal fitness and this kind of expansion into other aspects, like more into postpartum and menopause, and also the other direction into fertility. So it's expanded, but I've been lucky to do this for so long and kind of just keep learning along the way. And people do always ask me why I chose pregnancy because I am not like a mother myself yet, but it kind of just happened organically. Like when you work with women in their 20s and 30s, they become pregnant, and that's a very common occurrence. And it's really beneficial to just know how to handle it with confidence. And especially at the time when I started, there was a lot of people who didn't know how to handle pregnancy and postpartum from a fitness perspective. So it felt very needed. And in fact, I think it still is that way. And especially when it comes to fertility and like I'm sure we're going to talk about today, there's a lot of fear, misguiding information, conflicting information. So it's a lot to kind of navigate on your own. So I think someone like me who really like just does this is helpful for people. So it's been fun to be that person for people.
I think that's so cool. And you said something about, you know, a lot of people don't, or, you know, you got into, you know, pregnancy and postpartum, and that's not necessarily a niche a lot of people go through, but you just recognize as you're working with that population, having that specialty is super important. But I think it's so interesting because I think sometimes it's not even in like fitness or movement, but Laura and I both worked in the hospital as well and
Mhm.
worked labor and delivery. And like we worked with people from the ER and these different specialties. It's almost like pregnant women are like they have a virus or something. Everybody is scared of them in healthcare sometimes.
Yeah.
It's kind of crazy. It's like all of a sudden you're pregnant and no one knows how to deal with you. And
Mhm.
it's
Yep.
like, no, I still have all my other organs and everything happening and things. I just happen to be pregnant at the moment. And I think it's so, so needed that people are specializing in pregnancy, postpartum, fertility, and really owning into the support that we deserve when we're going through that stage of our life.
Yep.
So I think you said something, I don't remember exactly what you said, but I just was thinking back to like the ER just shooting people up to L&D and like not no matter what. It's like, oh, I came in
Yeah.
and my leg was hurting. It's like, oh, go to
Yeah.
L&D, you're pregnant. It's like,
Right.
no, you need to deal with the leg.
Yeah. Yeah. Well, that is part of kind of where all this confusion comes from, in my opinion. A lot of times with pregnancy, it's just treated like this completely delicate time that we have to, be absolutely the most careful and not do this, not do that. And a lot of times, that's not even actually based in evidence because, speaking of which, they're also really scared to study pregnant women, as you guys, I'm sure,
Right.
know.
Sure. Yeah.
So a lot of it is not even actually evidence based. It's more just like what has always been done. And so to have someone like me, where I literally work with pregnant women day in and day out, so I can like say with confidence, like, no, you're okay. You can do this. Like when I first started, I remember giving sessions. I'd be like, are you okay? Does this feel okay? Can you do this? And now I'm like, you can do this. You're fine. So I think that, yeah, it's just like that contrast of people looking for more information and being nervous to treat pregnancy versus just the comfort you have from it being what you do all the time.
Yeah.
I think even from a patient perspective too, I think as patients, especially those that have navigated a fertility journey or maybe have had a history of miscarriage, think I'm pregnant, I can't do anything, or it's going to result in me losing the pregnancy. Like, I know there's a lot of like, you can't get your heart rate over a certain threshold. And I know that is like, there doesn't seem to be any scientific backing that says that there's actually any heart rate threshold that you can't reach in pregnancy or it puts the
Right.
pregnancy at risk.
Yep.
But I think like, and I think about, there are certainly many pregnant women out there, especially I would say in like the limelight and the celebrity status, who maybe they're running marathons and they're like, 7 months pregnant, or they're bodybuilding and they're like super pregnant. And I think for some reason, like we just can't apply that to ourselves, maybe as lay people. It's like they're the exception to the rule. The rest of us, like, we just can't move because we don't want to mess up the pregnancy.
Yeah. I know. It's funny. I mean, I will probably talk about this again today, but everyone's threshold is completely different. So, what I would recommend for a marathon runner versus what I recommend for a casual exerciser is obviously going to be totally different. And the same
Yeah.
applies to pregnancy. But for the most part, I think people err in the wrong direction where it's this overly cautious approach. And it's kind of like you were saying before, Ashley, like you're still a person, you still have muscles and bones and joints that need you to move. Like, and I think, we don't actually look at the downside of those recommendations where we're telling people to not exercise throughout the pregnancy or not pick up anything heavy, but there are huge downsides. Like in your normal life, you wouldn't just say, I think I'm just going to not work out for a year and just not do any core, and then your back is hurting and you're like, oh, I wonder why my back is hurting. So it's just like we put people in such a bad situation because we make them feel like it is the best choice to pull back when actually there's no real studies to support it, and we're not actually looking at the flip side of that coin, which is it could even be harmful to pull back.
Yeah. And we're obviously going to get to fertility here in a second, but I do just want to mention like working your core and things like that, which I'm sure you may actually talk more about this. But I think, again, going back to Laura and I having history in labor and delivery, and obviously you see clients that do this too, actually working your core and your pelvis and that region in pregnancy, we have just seen easier deliveries, easier
Yeah.
recoveries.
Yep.
because you've trained those pelvic muscles and those ligaments and those joints, and there are safe ways to move. Obviously consulting a specialist like you, consulting your provider, making sure you're doing everything correctly. But we've seen it time and time again when you go, forward to the labor and delivery part and then the postpartum recovery. When you are doing those things and you're working out those parts that maybe not a lot of people think they should stay away from, or it's fearful, there's actually a lot of huge benefit in the labor and delivery and postpartum process. I mean, as you know, but
Mm-hmm.
I just wanted to like touch on that too. Is like
Yeah.
there's so many benefits in certain types of movement and not avoiding like the core and the pelvis and pelvic therapy and things like that.
Yeah, I'm sure it's true that you guys have seen anecdotally, but it's like statistically proven as well that you have decreased risk of C-section, shorter labors, decreased risk of hypertension and gestational diabetes. So there are tons of like proven benefits in addition to what you see. And I always just tell people it's like imagine you were going to be running a marathon in 9 months and you have 9 months to prepare. Would you just like slowly pull back more and more, or would you want to like take the time to really do whatever you can to be prepared when the time comes? So I agree. I think that I've seen it so much with the ease of birth, or and I'm never like, oh, if you exercise you're gonna have an easy birth, but
Right.
of course, like,
There's no
it's
guarantee.
totally, but it doesn't hurt and it often helps, and it definitely helps with recovery, like 100%. So yeah, I'm glad to hear that you guys see the same thing.
Can you speak a little bit for our listeners who are maybe they're newly pregnant or they're on a fertility journey and they're thinking about like incorporating some movement into their daily routine? What I've always been of the understanding, and I would love correction if I'm wrong, but that women who are pregnant shouldn't start any brand new like sort of workout regimen. Certainly, like if again, kind of using the marathon example, like if you've never run in your life, you shouldn't all of a sudden be like, I'm going to start running now that I'm, pregnant. Probably
Yeah.
not the safest way. But if you've been a runner and that's been incorporated into your lifestyle, like certainly it's safe to continue doing so during pregnancy, unless there's a contraindication as to why you can't.
Yeah, in regards to that, I would just say in general, I avoid those blanket statements. Like, I actually think a lot of people would agree with me. Maybe some would disagree, but I think the whole no starting any new exercise in pregnancy thing is a little bit debunked at this point, because there
Great.
are things I would tell you not to start during pregnancy. If you've never been a marathon runner, not the time. If you've never done boxing, not the time. But if you've never picked up weights and you want to start with some light weights and core work and pelvic floor work, there's literally no reason that that's not safe. And I always make the recommendation too, if you're going to be starting anything new, you should be doing it with someone who's trained in it, whether it's through a class, a trainer, or even something online. Like, just don't kind of throw yourself into something where you know nothing about it. It's more from the sense of like general injury, like tripping, falling, injuring your joints, like, which can happen with starting any new exercise. But there's nothing really contraindicated just because of pregnancy. The only exception I make to that is high impact things like running, because it does take time to build up the strength needed to be able to tolerate that. So, again, if you were already running a ton and you want to run for like the first half of your pregnancy, I'm totally fine with that. If you haven't run in 5 or 6 years and you're like, maybe I should start again, I would probably encourage you to wait till afterwards.
Makes sense.
Yeah.
Do you well, I guess I'll start with this question. How did you, so obviously you started out in pregnancy and postpartum. You probably by default saw some people that had navigated a fertility journey, now pregnant and whatnot. How did you sort of transition into also supporting and creating a program for people navigating IVF, egg freezing, going through stimulation? How did that journey progress? And then we can maybe talk a little bit more about exercise during that period.
Yeah. I don't know if you guys feel this way, but it's really interesting. Like, just the way people talk about IVF has changed so much over the past 10 years. And I remember when I was first starting out, and I don't know, people would not always open up to me about it. And they would kind of be like, I'm going to be doing IVF. and leave it at that. And I don't know if it was maybe that I was younger and I wasn't as comfortable asking questions, but I think that the conversation has become a lot more open in the past few years as well, which has really helped. And um, I feel like a lot of more people would come to me directly and open up and start asking questions. So that has been nice. I think in general, the conversation has like been more inclusive, which kind of piqued my interest as well. And then it was kind of the same thing. I mean, this sounds like a lame answer, but it was just like my clients were going through IVF. So then I was like, well, I better learn about it because I want to know what I'm talking about. And so it was actually kind of tricky to start educating myself because there aren't training programs for trainers to learn about fertility and exercise and how they go together. Like this is really kind of a newer field. So in some ways I had to go a little more like directly to the source. I did a lot of like reading of articles and seeing what was out there. But again, even that was kind of limited. And then actually just talking directly to doctors. And we'll talk about it when I mention more about the program. But I work with like some incredible nutritionists and acupuncturists who are really have like close relationships with some of these amazing fertility doctors in New York City, and they have asked these questions directly, and like I was able to kind of just open channels of conversation for me. But it's funny because I have a lot of certifications in prenatal fitness, but when it comes to fertility, like there's no such thing yet. So we're really kind of like paving the way right now to understand that better. So yeah, it was a lot of like self education, and then kind of getting to be able to connect directly with the real experts, which kind of solidified what I had already learned, but like gave it more of an official backing that I was comfortable with sharing.
Let's talk about your IVF program. So you mentioned that you've worked with nutritionists and acupuncturists, and you've obviously worked with some REIs, which obviously you and I both know, being from New York and being in the same area before. So, how did you create that program? What was the starting point for that? And again, it may have just been your learnings, like you were telling us, and like, hey, we need some education on this, which we absolutely do, and I absolutely love it. But yeah, how did that start, and the creation of that, and like how has it gone? Like, are people using it? Kind of fill us in.
Sure. So I always like to give credit where credit's due. And like I said, what really got me into the fertility world was just like connecting with some of these other amazing experts. So I was lucky to know Dr. Mary Sabo, who is an incredible acupuncturist and Chinese medicine specialist here in New York. And she has her own practice called Lillian Horn, but she also is the in house acupuncturist at CCRM. So she works really closely there. She like does acupuncture before and after transfers, which is so cool. And I've known her for years because we've shared patients and clients. She did a lot of pregnancy and postpartum before, and now has like transitioned more into this fertility world. But anyways, it was like all her idea. She wanted to have an option to give her patients who are asking questions about exercise. And she also had gone through a couple retrievals herself and been really stressed by the idea of not being able to exercise at all for 2 weeks and being given that kind of like strict recommendation. And so she came to me because she knew that I work so much with pregnancy and postpartum, and I know a thing or two about moving. So she was like, I wonder if you could make this. I was like, I can make this. Let's do it. So we went straight to Dr. Shiva Talabian of CCRM, and we right away kind of wanted to get insight and approval of what do you think is a good idea, what do you think is safe, and kind of start there. And then I went ahead and kind of built out the workouts and was really careful about every single exercise selection. And these were workouts, we designed it specifically for the stimulation phase. So those like couple weeks, it's a different amount of time for everybody leading up to a retrieval. So it's kind of for right before and right after a retrieval with like a notable pause in the middle, which we can talk about the structure. But yeah, that's how it kind of worked. And then I made the workouts. I filmed a few interviews with Mary and with Dr. Talabian, and we wanted to just kind of fill people in, kind of give people that additional peace of mind. And then Dr. Talabian watched every single workout to make sure everything felt safe and was like, had her seal of approval. And I just think it's really special to be able to say that it's REI approved, because I think it does give that extra peace of mind. And I will say, despite, like, I believe in this program so much, I think it's amazing for anyone who wants to give it a try, but I always leave the disclaimer of, at the end of the day, you're going to want to talk to your own personal doctor about your specific case, your body, what you need to be knowledgeable about as you're moving through things. And we really recommend people to even just take the program to the doctor, show it to them, and get more specific green lights, rather than, I think that just removes some of the stress around it. But yeah, and if you are kind of an uncomplicated case and your doctor is not concerned about it, then I think it's an amazing option for people who want to be able to keep doing some form of strength training, without having to feel like uncomfortable, or like they're putting themselves at risk.
Yeah, so but let's talk about the structure a little bit. And I just want to give a little bit of like a caveat to listeners. So, a lot of our listeners, potentially, if you've gone through an IVF cycle or an egg freezing cycle or that stimulation phase that we're talking about, you probably got a bunch of do's and don'ts and instructions, or maybe a little bit. And one of those things, most likely, was limit your exercise or don't exercise. There is a wide variety of instructions from different fertility clinics and different providers, and we can get into that a little bit too. But there is an exercise restriction as you are going through stimulation. As we are growing those follicles, we're headed towards an egg retrieval to utilize those eggs, whether we're freezing them or fertilizing them. Like Julia mentioned, it's about a 2-week process, from start of injections to egg retrieval. And then there's even some restrictions after that because things don't go back to normal right away. So there's an exercise period of, like, I'd say around 3-ish at least weeks where you're probably on some type of restriction, and that's going to vary from provider to provider and clinic to clinic. So just to give a little bit of context of like the time period we're talking about here. And the reason for that, as we kind of mentioned at the beginning, is because there is a risk of ovarian torsion. So in our normal everyday lives, ovaries are approximately the size of walnuts, right? They're pretty small. But if, the more eggs you have, the more follicles we're growing, those follicles grow, they get bigger. Our ovaries grow, they get bigger, they get heavier, and they have a slight risk of twisting. That's what the torsion is. It's very painful. And a lot of times it does redirect with treatment. But there are some people that have lost ovaries from that torsion, the loss of blood flow to that ovary. So, yes, it is absolutely a thing that you have to be very cautious of this, and you have to plan your movements accordingly. But I think the three of us can agree on this call is we don't have to stop it completely. And I think, to Julia's point, obviously, please, your specific case, your personal story and your journey, talk with your doctor. But I think there is a big misconception. I think it's getting better and better that, like, you can't do anything and you have to sit on the couch and you have to, whatnot. And it's like, that's not the case. You want blood flow, you want movement. It actually helps a lot of things, as you're taking hormone medication. So that was a very long-winded explanation of kind of where we're at. But Julie, I would love to kind of, if you could just like fill us in a little bit of like, how did you structure this, like movements, but as you're first starting out and things are a little bit smaller versus closer to that egg retrieval versus the recovery period?
Yeah, thank you. I think the context that you just gave is really helpful, because I think the entire premise of this is it's not one blanket large bucket of time. Like, there are nuanced periods in this entire process, and each one will kind of affect your exercise choices. So the first week of the program is like your first week of injections for everybody. And right away we start modifying, because it's kind of one of those things where you, depending on how you respond to the medications, you may or may not experience like swelling at that point. But it is just good practice to start getting into that modification habit. And we're almost a little extra conservative on that end. But also, some people might really be experiencing swelling in the first week. So the sooner we start modifying, the better, just to have that peace of mind. So, like, the main modifications you're going to see in the program is it's zero impact, like not even just low impact, zero impact. And it is fully like strength training based with a little bit of core, and there's even one no impact cardio, but again, it's it's possible to get your heart rate up without impact, and it's possible to strength train without impact. So those are the types of movements we're focusing on. And then the other things that I kept in mind were, it's funny, I almost applied the way I think of pregnancy training. Like, imagine you have like a little bubble and you're trying to protect the bubble. So there's no like compression forwards, there's no deep twisting, there's no like anything that's cross body, elbow to knee, anything where you're compressing the area around the pelvis and the ovary. And it's a little more what I call square, like shoulders over hips, and a little bit more stacked, a little bit more aligned, so that you're not crowding the pelvis, and the pelvis and the ovaries have room to breathe. And I feel like it's funny because you think, how can you get anything done like that? You're barely moving.
What are you doing if you're not?
Yeah, the workouts are just you standing still. But
Right?
it's funny. You just have to get a little bit creative. And like, I have been doing this so long, I'm just very creative. Like, there's side lying positions, there's standing positions, there's hands and knees positions, but you're not going to see like a deep lunge with a twist and stuff like that. So it's kind of just you can probably do a little more than you think, but especially that second week of the program, we really are keeping things nice and square. But yeah, you'd be surprised. I encourage everyone to check it out, because you might think like, how are you going to actually get a good workout? But they're hard. And I'll talk about my own personal experience with it later, because I did recently freeze my own eggs, and I did my own workouts from the program, and I was like, oh my gosh, these are hard. But I felt safe because I knew that everything was completely safe. There was no crowding, but it still provides a good challenge. So anyways, back to the structure. The first week is for your first kind of like 6 to 7 days of your injections. And then the second week of the program is for, I would say, like the remainder, but with the caveat that like everyone's going to have a different amount of time for the injections. And it doesn't have to be, this is the first week, this is the second week, but it's kind of just split that way. And we really recommend, me, Mary, Dr. Talabian, we all really recommend full rest in the, I would say, 2 to 3 days before and 2 to 3 days after the retrieval, because that is when the ovaries are at their largest and the risk of the torsion is highest. So we actually provided meditations for those weeks, so that, or those days, I should say, so that you have something that you could do to kind of calm your body, connect to your nervous system, do a little something for yourself. But we really don't feel it's necessary to fit in a full workout at that point, just because the risk is just much higher. And then what I recommend, that's how the program's structured. That's all of the weeks. But what I recommend is actually that when people feel like after a couple days post retrieval, they feel recovered, they can start to ease back in the reverse. So they can start with the second week of workouts, because they're the most modified, and then go back to the first week of workouts, which are a little less modified, and then hopefully go back to whatever their normal routine had been. So again, it's like, instead of thinking this is the period of time you can't work out, it's you can do more than you think, you can do less than you think, you should rest, you can do less than you think, you can do more than you think, you can go back. Yeah, and again, I feel like this was kind of intuitive for me, because that's very similar to the curve I kind of teach when I'm teaching people prenatal and postpartum fitness. Like, we start off here, we taper, we modify, we rest, and then we taper and modify, and then we grow back into full workouts. So it's kind of just removing this off or on, yes or no, black and white thinking from it, and more so just getting a little more creative with what we can and can't do, and not feeling like you have to figure that out for yourself, and know that it's been vetted many times.
I love the terminology black and white thinking. I think a lot of it is very much a gray zone, but I think maybe a lot of providers out there, including nurses, including physicians, right? I think we all kind of think, well, it's just easier to tell patients not to do anything, right? Because then we don't have to be liable for anything that might happen, or if they might misconstrue what we're saying is okay and take it too far and end up, in the emergency room. But I love
Yeah.
the way that you kind of showed that visual of like tapering down and tapering back up. I think is a really nice way to just kind of visualize how that should work. So I love this program. I'm curious, obviously, as we said, those ovaries are really teeny tiny in the beginning. And, when we're not on a menstrual cycle, but during IVF, they get really large. And a lot of the side effects that I think most people have that maybe they're a little surprised about, because I think a lot of people think, oh, emotional side effects, that's going to be the biggest thing. And usually it's the physical side effects. It's the bloating, it's the abdominal cramping. And I wonder, by incorporating some movement, not being sedentary, I even think post egg retrieval, when there's a higher rate of constipation, because things are slowed down in our digestive tract from hormones and also from anesthesia. Like, have you noticed any improvement maybe in some of those symptoms just by keeping our bodies and our blood flow moving throughout the process?
Yeah, I mean, I think there's definitely truth to that. Again, it's more like anecdotal. I don't know if it's going to
Sure.
happen for everyone across the board, but it's for us, for both me and Mary, when we were designing the program, it's more like, what can we do to mitigate you feeling like you're out of your routine completely and your body is totally out of whack? So, like, exercise always helps with blood flow, exercise always helps with mood, and it always helps to like get up and move for your digestive system and stuff, right? So all those things are still true, and I think it's more of a way to like tamper the effects so that you feel them slightly less. You feel a little more like yourself. Your routine feels a little more like your normal day. And then physically, hopefully you feel a little better than you would if you had been sedentary. And just speaking from personal experience, like I said, I had gone through this recently, and it's hard for me to imagine not moving, even though sometimes I really enjoy that because I do move so much. But when I went through the process, I was like, yeah, it's time to get moving again. Like, it just doesn't feel great to sit there. And we can talk later about like the symptoms I was having. But yeah, I feel like it does really help you feel more like yourself, and even just physically a lot better.
How do you, and this is probably less so with your program because it's a free program, so you don't have as much of a direct connection, but so this may be more kind of going backwards to your prenatal and your postpartum clients, or you people listening, you can work with her one-on-one for during IVF as well, outside of the program. But how do you navigate, we were talking about this on another episode, just like almost like the two-sided one, like the guilt of like, if I do something or if I don't do something, then I've caused this to happen or this not to happen, or
Mhm.
even like the sense of control, right? Like in a very uncontrollable situation, we want to kind of do as much as possible, or you know how do you, have you encountered that, like how do you navigate, I guess, sort of that emotional piece of movement in a very sensitive situation when you're talking about people going through and navigating a fertility journey, and that sort of like control, guilt, doing something, not doing something, and sort of like blaming yourself one way or another? Like, have you encountered that? Like, how do you incorporate that sort of conversation into movement practice?
Yeah, that's a great question, and it's something that we've thought about a lot. Um, I think the way I think of it is everyone comes to this program in such a different place. Like, someone might be freezing their eggs just because they want the reassurance, and someone might be going through retrieval for the fourth or fifth time and have had so much loss and strain and stress leading up to it. And those are going to be very different nervous systems going into that retrieval. So it's like, for me, I always just ask the person, what is going to be less stressful for you? If it is going to just stress you out, make you more nervous, even with all the reassurance that this is safe, you can't do anything wrong, and you're still going to be worried about it, don't do it. It's okay. Like, I'm not trying to force anyone to
Yeah.
work out during this process. If you don't want to, you don't have to. Get out for a couple walks. Try not to be totally sedentary, but it's fine. And then on the other hand, you have people who are not worried about it at all and might actually go too far and do a little too much, right? But it really depends what is going to be stressful for you. So for some people, it's actually more stressful to be told that they can't and to feel like they're completely out of their routine, they're losing progress, or they're just like not themselves, or they don't have any way to kind of process their feelings in a physical way. So it really just is so individual. And I try, despite everything I know, which is that exercise doesn't actually cause miscarriage, and that, it's safe to do in the ways we've recommended in this program, I still try to be really sensitive of the full picture of the journey people are having. And there are people who are going to be stressed, and rightfully so, so I just want people to make the choice that makes them feel the best. It's kind of just there as an option for you. I recommend it. I recommend people move always, but I want you to listen to your body too. And I also think we as women tend to have really strong intuition and like connections to our bodies. So listen to what your body's asking for. This is the like woo woo dancer side of me coming out, but I'm just like, I take it too far. I'm like, my body says I have to rest today. But in my process, it was not linear. When I was going through the injections, I some days wanted to work out, and then I like kind of plateaued early on, and I didn't want to work out, and it was only like day 5, and I was like, oh, it's only day 5, I should probably still be working out. And then like 2 days before the retrieval, I was like, I feel like I could get a little sneaky workout in. So it's just funny, like you have to just really kind of trust what your body needs, and it's just also individual.
I swear someday I'm going to go back through all of these videos and I'm going to clip every single piece where we've used the word not linear.
Yeah.
It's real because it's just,
You should.
speaking
I
my love
know.
language. It's not linear.
Yeah.
I know
Right.
every single time someone says it, I like look immediately at like
I
Lauren
saw
during
you
the
look at me.
podcast. I'm like, I know it. I know. Yeah.
It's true.
It is true, right? Like, and I think we put a lot of pressure on ourselves too as a piece of it of doing the right thing or having to do X, Y, and Z. And it's like, you know what? Sometimes you just need to chill. We all do. Sometimes it's
Yeah.
chilling. Sometimes it's like, you know what? I need to get myself up today. I need to do some movement, and kind of encouraging yourself. And some days you really want to, and you're super excited about it. And I think that's awesome that you can make it personal. Like, yes, it's a program. Yes, you can, work with a specialist, but it very much is not linear. And as the whole process is not, and you can make the best decisions for yourself. But the fact that something like this exists when it hasn't before, and that we're talking about it more, and we're sort of trying to debunk all this, I think is one of the biggest things, right? Is like, let's talk about it from a real perspective and not just make it so black and white. And there are options and all those things, which I think you are doing, which is so fantastic.
Yeah. And one of the other things I wanted to share, because you were asking earlier about how it's been received, like it's actually been so cool to see how it's been received. And I'm really happy we decided to make it free, because that just removes any barrier. It's the only free workout program for IVF that is safe and REI approved. So we have had downloads from all over the world. Like I am talking 1 week, like things were coming in. It was like Scotland, Serbia, Switzerland, like South America. It's literally everywhere. So, and people are finding it on Reddit and on Chat GPT and on YouTube. And so people are looking for this information. And like I was saying before, it's not like I'm not out here trying to preach to everyone that you have to work out during IVF. I'm trying to say that if you would like to work out during IVF, you can. And here is a safe way to do it. So it's nice to be able to provide that.
I love it. Well, I mean, I now know where I will be sending clients when they ask me of, can I work out? And I'll say, here's this lovely free resource. Check it out.
Thank you.
I wonder, do you have any resources, or have you thought about curating any resources around the time or post embryo transfer for patients? There's definitely a lot. I think retrieval is one of the aspects, right? And it's because of the risk of ovarian torsion. I think the flip side is the time of the embryo transfer. And I know when I started working in the fertility space 13 years ago, where I worked, we told people couch rest. I still see clinics giving bed rest recommendations, which drives me a little bit crazy, because at least every study that I have read as of late says that getting up and having blood flow to the uterus can actually be productive and beneficial. But I think, again, because the stakes are so high, I see a lot of clinics saying, got to be on complete bed rest, like don't get out of bed for a few days. I'm just wondering, like, what have you maybe learned on this topic?
Yeah, I mean, I really was so lucky to work with CCRM. I think, Ashley knows them really well and worked with them for years as well. Like, they're just such a solid, reputable clinic. So I'm really happy to kind of just align with their stance on this because they're the true experts, obviously. And so we do have an interview with Dr. Talabian and Dr. Sabo on the program about transfer because I didn't want to not touch on it entirely. But it's funny because I almost feel like it's even less black and white. Like, this transfer phase, it's like everybody's going to have a different recommendation.
Yeah.
But personally, I really like what Dr. Talabian had to say, which was, she's like, as a clinician, I know the second we do the transfer, it either took or it didn't. And whether you do a little exercising that day or not, it's very, very, very unlikely to make any effect. But she also said that she knows that her patients, if they decided to work out that day and then experience the loss, they would never forgive themselves,
Right.
And so that's what I was kind of talking about before, where it's like you just have to be sensitive of how much this means to people, how much money and time they've put into it. And I actually really go back and forth because, again, I'm like, this is your decision. I think I would probably not work out within like a 3-day window or something. But other than that, like, I definitely would never think bed rest. I think that's kind of wacky, but that's just me. Um,
I
like,
mean, we used to put patients in the reverse Trendelenburg
yeah,
position. So,
Yep.
I mean, hopefully there are no
yeah.
clinics doing that anymore.
Yeah, but I also always like to point out, because this brings me to some of the silly arbitrary recommendations they make for pregnancy, because they're like, don't lift more than 15 pounds. And I'm like, how many pregnant women have 40-pound toddlers and children at home that they're lifting it all day every day
Yeah.
anyways? And they're like, don't do a squat. And I'm like, well, every time you sit down and stand up, you're doing a squat. So it's just, movement
Yeah.
is just movement, and you move your body all day anyways. So the difference between sitting at home or sitting at home and doing 20 bicep curls is minimal to your uterus. So again, it's just more, I think that I just recommend people do what feels best to them. I would probably recommend light rest for 1 to 3 days, and then, like, we're good to go.
Yeah.
um, and I guess probably what I would also say is that it's always good to remember that exercise is a form of stress. So it's a stress relief for many people, but it also is literal physical stress to your body and your system. So, it's always that helpful piece of advice when you're waiting. It's like, don't be stressed. But the
We had a
same is
whole episode debunking.
so helpful, right? But the same is true of exercise. Like, if you're gonna do a crazy hit workout where you feel totally stressed and depleted, maybe that's not the best thing to be doing during that period. But like a little light stress from a regular strength training workout is nominal.
Yeah.
I think you brought up a really interesting point, that there is so much outdated information, and how not only outdated information, but like how we still say things that causes fear, and which is why I think we've gotten where we are, of like, we can't be moving, we have to be sedentary, we shouldn't be doing X, Y, and Z. And I think that, and then that causes the guilt and kind of all those things we've been talking about. So I think you hit on that so importantly. Like, we need updated information. We need things like you're doing to say, hey, it is up to you, 1,000%. And I love that. It is personalized. But we shouldn't be saying, like, oh, don't do this, or you can't lift 15 pounds. Because the reality is, life is still happening, right? Like, people are going to work, they're traveling. You can't squat. Well, yeah, you're sitting down. Like, we need to reframe the way that we as professionals in the space are communicating and saying these things, so we aren't causing the fear that some people have, or then that causes like the guilt because, oh my gosh, I did lift my toddler and now I might have a little bit of spotting. And yeah,
Yeah.
that's super stressful and fearful. And
Yeah.
that we blame ourselves, that like, oh, that action caused this. So I think we can do better as professionals, and having a resource like this and having these conversations, I think, helps so, so much.
Yeah, I think
Yeah.
we need experts like you in the field doing things like this, because I think, again, we've said doctors across clinics all have different different ways of doing things. And then that leads to somebody posting on TikTok what their doctor said. And then somebody else going, well, my doctor said something completely different.
Yeah.
Right. And so having one source or, some sort of curated, information that is evidence-based that we can actually point patients to, that doctors can point their patients to and say, look, this isn't necessarily my area of expertise, or, hey, this is what I typically tell patients. However, there's these great resources out here that you can go and you can take a look at, rather than this, like, again, I mean, we talk about all the time, this comparison that happens in the fertility space.
Yeah, and I think that's part of it. Doctors have such overloaded plates, and it's okay for them to not be fitness experts. That's just not what they do.
Yeah.
So, they don't have to know exactly how to make those recommendations. Like you said, it is healthier for them, if they can, to just refer out for those things. So I always appreciate when I see that. And like the last thing I wanted to say that you reminded me is, sometimes I feel like exercise is viewed as this like frivolous thing that people are doing for aesthetic reasons. And so they're like, just don't do that. Why do you need to exercise? Just stop exercising for a few weeks. But that's not the way I view it. And then that's not the way a lot of my clients view it. Like, we're exercising to be able to lift our toddlers. We're exercising to be able to move well throughout the end of pregnancy. So it's not like this thing you're just doing for fun electively. It's really something that you're doing for your health. And it shouldn't be just nixed so easily, because it is a key foundational component of health.
Yeah. Let's switch gears a little bit, because I would love to give you the opportunity to, not only have you created this, you have also lived a stimulation experience. And like you've already said, you did your own exercises, you listened to your body, all this. So would love, and we haven't really talked about fertility preservation a ton on the podcast to this date. So I would love for you to talk a little bit more about your experience, your, obviously, your physical experience, your emotional, mental, talk about your exercise program. But I think if you could start out just by telling us, like, what was the decision factor? I think a lot of people, like, when is the right time to do X, Y, and Z? And everyone's going to be different. Obviously, yours is a very personal story. But if you don't mind just sharing, to kind of kicking it off, like, what
Yeah.
made you decide to freeze your eggs and why now, and kind of that decision?
Yeah, for sure. So I'm a super open book, so I'm just gonna lay it all out there.
Love
So I'll
that.
tell you everything. But, so I've been working with fertility for longer than I've even considered freezing my eggs, because I was probably in my mid to late 20s when I started really thinking more about fertility in a professional sense. And I hadn't really considered freezing my eggs because, to be completely transparent, I have my own business. I'm self employed. There was no one who was going to fund this journey for me, like, no amazing benefits that were going to swoop in and do it. So I was like, well, let's just hope that I don't need to, or I'll be okay if I don't, even though I always thought, wow, it would be really cool to be able to do that. Then Mary approached me. We made the program. I got to know some of the doctors at CCRM. One of the other doctors there, Dr. Ariel Bayer, actually became my my client. So I train her and we work out together. And so she started kind of working on me. She was like, you should really freeze your eggs. I'll do it for you. So that was fun. Like, we just have a very nice relationship. So I was like, well, if I'm going to, I will, of course, do it with you. Um, but still, the cost factor was just a huge thing. I was like, at the time I was about 30, 31, and I was like, well, that's a huge investment if I don't know if I'm going to need it, or really I have any necessarily reasons to think I might need it. So, I was lucky to be in that position, but I've always had really regular cycles. Like, I feel I'm a very healthy person. So I was like, I mean, I know it's a good idea, but I just don't know if it's feasible. And then my partner found out that through his company, he was able to cover my egg freezing, even though we were not married. And
Awesome.
I was shocked by that. I was like, double check, that sounds wrong. But, it was true. And so that was amazing. So when I found that out, I was like, well, at that point, why would we not? So yeah, I made the decision to do it. I was 31. It was just a few months ago, and it felt like a good time to do it. I feel like even though I'm in a stable relationship and I'm hoping to be able to start trying in a few years, and I would like to try naturally, I also think that you just absolutely never know. And I would never want to be in a situation where I look back and think, well, I had the opportunity, especially with the aspect of it being covered. Um, so yeah, I just kind of decided to go for it, and my partner was like very supportive of me wanting to do it, and it was just like a good choice for us. So we went in together, and we did all of the genetic testing and all the testing involved beforehand. And I will say, like, one of the things that surprised me most was how fascinating I found all of that and how helpful I found all of that, because there are just so many things you don't think of. And like, I was kind of planning to just go through my life without ever doing any of that before trying. And I'm now actually really glad that we have the information that we have from the entire process. Because even if I do try naturally, I just know so much more about my body, our bodies, our history, and everything. And then I also will get to have the peace of mind. So yeah, it was a very lucky situation for me. I'm not gonna lie.
I love that. I love what you just said about having information and now being able to, like, when you guys are ready to start trying or when you're ready to start trying, like, you have a full picture of what your fertility looks like. And this could be a whole topic for a whole nother episode, but I just am so much a believer in the power. Like, knowledge is power. And I think, we do a lot of delay in the fertility space. I think a lot of that, I love OBs, but I think a lot of OBs do a lot of delaying where we could really get some information for patients before they've tried and are mentally exhausted, right? And then later we found out, oh, your husband has no sperm, or your tubes are
Yeah.
blocked, or you have premature ovarian insufficiency, meaning you are in menopause in your early 30s. And like, we could have tested that before. So I know this is a little off
Yeah.
topic, but I love that you said that, because you have that knowledge now, and I think you'll probably feel more confident when you do start trying.
Yeah. No, I completely agree with you. And that was truly like the biggest takeaway. Like, I'm very grateful to have gotten the number of eggs I got and have them. But I really am just like, wow, I know so much more now. And it's like I said, it was something I had never even considered. And, I have a lot of friends who are all in this phase of life right now. And have been encouraging people. I'm like, especially if it's available to you, obviously it's not cheap. So if it's out of pocket, that's one thing, but a lot of people get really great benefits that cover these types of things. So if that is available to you, I personally love to go into things with as much information as possible. So I find that really cool that we have that technology now. And it can just make something that can be so strenuous a little easier.
Yeah, I think there's such a big misconception that seeing a fertility doctor or starting to ask those questions automatically equals, oh, I saw a fertility doctor, I'm going into IVF or I'm going into fertility treatment.
Yep.
And there's so many wonderful physicians out there trying to debunk that, but there's still such a stigma around that. And you're right, Laura, like, OB is just not saying that. And so I think talking about that is so important. It could just be informational. Like, hey, what's going on in my body? What's going on in my reproductive body? Should I be concerned about anything in the future? People are having kids or deciding to have kids later in life. There's so many pieces that we need to be having these conversations sooner. We need to be educating ourselves sooner. Middle school sex ed did not prepare us for having real fertility conversations. And then it's like nothing. And then you go to your OB and they're like, oh, put you on birth control because
Yeah.
that we're gonna you don't want kids right now, okay, we'll put you on birth control. Well, there's zero conversation of like and there's so many different iterations of this, and I'm overgeneralizing obviously, but you hit on such an important point talking about your journey of like, I got all this information. It's like, that is 1000% what I wish it was just a part of. Like, yep, we got pap smears every 3 years, or we did mammograms
I
annually.
was literally just going
Let's
to say
just
that.
21, 25,
Yeah.
we do an exam, we do a
Yeah.
semen analysis, we
We do
just
a semen analysis, we do an AMH level, we do some day
just
3
check it.
hormones. Let's just do a quick check.
Yeah. even just like the ultrasound and seeing how many follicles I had at the time, how everything was like looking, was more information than I had ever gotten. And like, how difficult would it be to do an ultrasound at
Or
your
some blood
annual,
work.
you know?
Yeah.
Yeah.
Yeah, like I don't know why that's not part of just like care.
Yep.
Right? Like why have we not made that part of care? Maybe we'll see that in the future, I hope, but we just haven't put that as like a proactive approach to reproduction.
Well, I think I
So
think we can blame insurance for a lot of that.
pro- we could blame a lot of things on insurance. That's a whole nother topic
I
too,
usually
but
do.
um Julia, did you what like talk a little bit more about your experience? You obviously have taught yourself a lot. You work alongside professionals in the field. So you kind of came in with, I mean, you still learn stuff, which I think is a big point to make too. You can still always learn more even though you feel like you have this understanding. But yeah, like what surprised you the most? What was the most potentially difficult experience? Like could you maybe like talk about that a little bit more?
Yeah, I think, I did feel rather prepared because I had just been around it so much, especially in the year leading up to it, because it was like within a year of me releasing the program and promoting the program and everything. So I had been kind of immersed already. So I was very familiar with, and I try to educate myself a lot. So I understood lots of like when she was pointing out the fog, I'm like, yep, I know what that is. I know what that is. But, being inside your body and feeling everything was definitely different. And um, I was rather lucky in that I feel the hormone dosages I got were not crazy, so I didn't have a lot of like emotional or like even really hormonal side effects. But I was fatigued a lot, and it's funny. I noticed like people's bodies just kind of respond to things in patterns, and like for me, I get fatigued a lot, and I have GI issues in general, and those were the two things that happened to me during like I was fatigued and I had GI issues. But other than that, I was actually really good. But yeah, I was a little surprised by how much the medications messed with my GI system. And it took a while to regulate after that because it was a little balance. Like, do I need a stool softener or do I need Imodium? Like, I was like, I don't know, one way or the other. I was,
Reality.
yeah. So
Yep. Yeah.
that was truly the worst part because other than that, I felt pretty good. And I felt really like comfortable and confident. Um, and the other thing that, I was lucky because right when I started, I recorded an interview with Ashley for
Yeah.
the program, and she was going over a lot of the logistical side of things. And so I was like, okay, got it, got it. But, I had started some of it before we talked. And the other side that really surprised me was just how much, I almost want to say like clerical work you have to do as the
Yes.
patient to stay organized and make sure you have what you need.
Yeah.
Like I shouldn't say this, but I always say like I'm like, imagine if men had to do this. Like I'm like, thank God it's women. We're
Seriously.
like, yep, got it. I'm like, I need 0.25 of those and we're on it. But you have to be super on top of things, and you're just doing it a lot, like pretty much every day. A lot of your day is dedicated to either making sure you're home to get the injections in the morning or the evening, going to your appointments, and messaging the pharmacy. Like it's just a lot of logistics.
Yeah.
And even though I kind of knew that I had to do that, I was just surprised by like Ashley said in her interview, and it's great advice. Like really clear out that schedule for that time as much as you can, like almost more than you think, because it's going to be taking up your days. Like you're going to be doing it a lot. And that's one of the other things that I've never really liked when people just toss around, oh, just freeze your eggs. Like, don't worry about it. You can just freeze your eggs. There are so many reasons you shouldn't say it like that. But like, number one, it's expensive. Number two, it's not just 2 weeks. And number three,
Yeah.
like, it's an intense process where you're like really doing a lot. So yeah, that was my takeaway. I was just like, it's not for the faint of heart. And actually, one other thing I'll share is my cycle after the fact was really tough. I sometimes get really extremely bad periods, like very sporadically, and it happened to me right after because
Yeah.
my body was just processing all the extra hormones and things being out of whack. And I was like, that wasn't fun, but it's part of it. And now I've had a normal cycle since, like, I'm fine. But yeah, it's not 2 weeks. It really is like at least a month or more of your life that's affected by it. So I think that's just something else to take into consideration if you're considering doing it.
Yeah.
Yeah. Would you, in general, do you recommend to people, like if you're talking with people and you're telling them your egg freezing experience, and obviously you have these caveats, and everyone's experience is going to be different, everyone's financial situation is going to be different because there are so many components to it. But in
Yep.
general, like, was it a good experience? Do you feel, better after doing it? Not like physically, but just like I have those eggs now, kind of like what we were talking about. It's like I have this, it's not a guaranteed safety net, but it's like you never know.
Yep.
Um, so yeah, like, and again, this is going to be personal to you, but like, do you generally recommend it? Are you generally positive about it? Obviously, given all these caveats.
Yeah, again, I would just say, like, everyone's so individual and unique, but I am lucky that I had a great experience. Like, I am so glad I did it. I really had a really good yield, if you will. So, like, a lot of eggs that I can fall back on, which is really comforting to know. And I didn't respond super badly. So, I'm just like, I'm really grateful. Like, I had a really nice experience. I loved working with my doctor, Dr. Bayer, and I loved CCRM. And so, yeah, for me, it was definitely worth it. And I'm so glad I did it. But again, I'm like, I don't presume to make recommendations for others because there's just so many factors that do go into it. And, I've had people close to me who put in the same amount of money, effort, time, and, we're not as satisfied with the results. So
Yeah.
you can't promise any one experience. And it was so funny because I was talking to my doctor about that. Like, when she told me the number of the eggs, I thought she was joking. I was just like, is that even possible? And she was like, maybe you have PCOS. And I was like, okay, I'll figure that out. But, I was like, I think, it's just genetics sometimes. Like, I am a very healthy person, and I like to think that that may have contributed some, but a lot of it is just luck and, like, really unpredictable. So, you know, I think
Fertility
that
is not a linear journey. I'm just going to say that.
exactly.
Not linear. We're wrapping up
Exactly.
here on just over an hour, I think. I would love to give you, Julia, an opportunity to kind of, impart maybe some final words with our listeners. And again, also tell us where they can find you. We're certainly going to link everything in the show notes. But do you have any like final takeaways that, you can impart for them, and tell us where they can find you?
Yes, I'm actually going to steal something Ashley said because it's really sticking with me. I love it. Like, when you're pregnant, postpartum, or going through fertility treatments, you're still a person. Like, your muscles and bones and joints are still you, and they still need you, So it can feel like everything's changed, but at the same time, movement is just so beneficial, just as it is in every other part of your life. So, if you can find resources like mine where you feel safe and you trust what you're doing, then I just highly encourage people to keep active as much as they feel able to throughout these times, because you will be surprised at how much better it makes you feel, and how it can really, like, enhance your results. So, more often than not, I just recommend people to try to move more rather than less during these times. And I think people need to hear that it's okay to do that.
Okay, move.
Yeah. It's
Um,
like give yourself permission to listen to your body, but it's also okay to move your body and in safe
yeah,
ways and find people that can help you, like Julia, and give you
yeah.
those safe movements. Um, Julia, where can people find you? How can they work with you? How can they find your free program? You have some exciting
Mhm.
things coming up. Tell us all about
So
it.
true. Yes. Okay. So my company's called Her Move Wellness. My website is hermovewellness.com. You can find me on Instagram at hermove. One of the best ways to connect with me, no matter where you're at, is I offer free consultations to anybody who wants to chat, because, as I've said a million times today, everyone's journey is unique. So I actually love meeting people and just, like, troubleshooting what would help them the most. I do one on one training in New York City. I do virtual one on one training. And then I have the free IVF online program. And then I also have an online program for pregnancy and postpartum. That's kind of like a follow your own pace, but you have constant support from me. You can ask me questions, get advice, personalized kind of feedback. So those are all the different ways. It really just depends what works for you. But I highly recommend that if you have any questions or you want to learn more, or if you just want any peace of mind, then let's chat and we can do a call. So you can find that on my website.
Amazing.
Awesome. Thank you so much for talking with us today. This was such a needed, important conversation. I hope it resonated with a lot of our listeners, no matter where you are in your reproductive journey. We kind of touched on a lot, which I think is fantastic. So thank you, Julia, so much for being here. To our listeners, as always, please like, subscribe, share, DM us. We'd love to hear from you. What do you want to talk about in the future? How do you think the podcast is going? Good or bad? We love feedback. So we would love to hear from each and every one of you. And yeah, we will wrap up there and we will see you all next week.
See you next week. If this conversation resonated, like, comment, or subscribe, share, send us your questions. Nothing is off limits.
And wherever you are in your journey, know this: you deserve support that's real and human. Never forget to ask your questions, advocate louder, and remember, you're not crazy. Fertility is hard.
That's it for today's episode of Fertility Nurses Unfiltered. Thanks for spending your time with us today.
We'll see you next time.